Good evening. I'm Dr. Chesney, and what I'm going to do tonight is leave you with a visual and audio report on what I also provided in writing on this week's first discussion. The first paragraph of this week's Unit 1 reading discussed the history of using research to support nursing practice. The use of research to guide practice has not always been the case. As a matter of fact, it wasn't until the late 1960s, early 1970s that nursing practice began to be guided by nursing research. An actual example of the progression of care based on nursing research is how new mothers are cared for following childbirth. When my mother gave birth to my sister in the early 1940s, mothers were kept in bed for 2 weeks. It was felt the new mothers needed the rest. By the time I gave birth to my oldest son in the late 1960s, the Lamaze movement was in full swing. I was out of bed the first day and the hospital in 5 days. By the time I gave birth to our third son in 1976, I left the hospital in 24 hours. My mother was appalled that I left so soon. I left after 3 days with baby number 2, and she was upset with this discharge as well. The practice of keeping mothers in bed was not done based on evidence that helped the mother recover, but because someone thought it was a good idea to let the mothers rest. As you can imagine, many new mothers had some serious health problems because of the lack of activity. It was evidence-based practice and the demands of many new mothers that forced the changes. As you continue to read through the Unit 1 article, you'll learn more about the history of nursing research and may have discovered a strong public health focus based on the principles of health promotion and disease prevention. Because of the implementation of the Affordable Care Act, more emphasis is being placed on prevention. No longer are the prevalent health problems in the United States caused by bacteria and viruses. Instead, they're caused by lifestyle decisions that are both personal and environmental. To avoid a continuation of stories like my one about postpartum care, nursing care decisions need to be based on evidence. Doing something because we always did it that way is no longer acceptable. Several of this week's readings address the 3 areas that are critical to demonstrating the importance of the profession of nursing and provide proof that nursing is a profession. The areas are credibility, accountability, and cost effectiveness. If as a profession we fail to address these areas, we make it difficult to present the case that nursing is a profession and fail to provide credibility. As we obtain more independence, we need to be able to support our decisions with sound rationale. The rationales are developed from the results of studies that follow the principles of sound research, therefore providing accountability. And lastly is cost effectiveness. Over the years, when economic times are difficult and healthcare institutions of all types face budget constraints, one of the first things to be considered for a reduction is the nursing staff. Outside of physicians and pharmacists, occasionally, nurses are the most expensive personnel. Because of staffing cuts, nursing often faces unrealistic demands on their time, and things that should only be done by registered nurses are handed off to less well-trained staff. For example, we now have medication technicians who distribute medications to residents in facilities outside of hospitals. The belief is if the staff receives some basic training about the medications, there's no need for an expensive nurse to make the rounds. What is missed is the interactions that take place between the nurse and the patient during these rounds. Some research has been done to demonstrate it is more cost-effective to have RNs caring for patients, but more needs to be done. It can be very difficult to convince a hospital board and administration that keeping the nurses is a cost-saving practice, let alone the need for patient satisfaction. If we cannot prove it by showing a reduction in falls, a reduction in infections, and a reductions in readmissions for the same health problem. RNs trained at all levels of higher education can play an important role in helping to develop research to advance the profession. At the baccalaureate level, you can initiate research studies by asking the question, why? Why are we doing this? Has anything changed in how this is done? you could offer to help gather data to answer the why question. As one of you stated in your introduction, you can read the journal articles to find ways to apply the new knowledge to your practice. Here are some ideas that I think are important to research. How can we reduce the incidence of type 2 diabetes in young children? How can we do the same among American Indians, who incidentally have the highest rates of type 2 diabetes of any ethnic group in the United States? And, losing my place. If nursing practice is provided in a home health setting where interpreters are required, how can we structure the allocation of time for care in these settings to meet the needs of the patient and control costs? How can we staff units and facilities to avoid placing patients and nurses at risk for injury? And how can we reduce the loss of new grads who leave practice after 1 or 2 years? These ideas only scratch the surface of the critical areas of importance: credibility, accountability, and cost effectiveness. One of the first things you need to be able to do is determine if what you are reading is worthy of inclusion in practice. Unfortunately, not everything published in journals is high-quality research. At the baccalaureate level, you need to develop the tools to learning the basic steps in designing a study to become a critical reader of research. Look for evidence of these steps when you read the articles. If evidence of a step is missing, you should be a bit skeptical about the quality of the study. You also need to be able to identify quantitative and qualitative research. As this week's readings discuss, proponents of these two broad ways of carrying out research are often at odds with each other, each claiming their approach is stronger and produces more useful results than the other. In fact, we need both, and the best studies combine quantitative and qualitative research into a format called mixed methods. Sometimes the first step in answering a question is to do quantitative research. A survey may be done by asking questions about a topic to look for a trend. This may be followed by a qualitative study where the researcher then looks for a small number of people who meet a specific set of criteria. Participants are asked open-ended questions focusing on the trends found in the survey in order to find out if what appears to be important is indeed the case. Other times, studies begin with open-ended questions. Neither method is superior to the other. Both are needed in research. An important thing to keep in mind is the mindset of the researcher. Often, quantitative researchers will state that qualitative researchers are susceptible to bias because they interact with the subjects. What quantitative researchers fail to realize is both types of research can be biased. When data are analyzed, the strong beliefs of the researcher can influence how they interpret the data. What is needed is an awareness of one's beliefs and values, and to keep them in mind during all phases of the study. Doing so can help reduce the temptation to find the answer wanted rather than the answer that appears. This also applies to the reader. As I read through the posts, I noticed frequent comments that implied the research some of you did was not viewed as very important. Nurses and many non-nurses think of research as only work done by those with advanced degrees in labs with white coats, as well as large numbers of participants and lots of money. But as some of you pointed out, this is not always the case. Several of you have been involved in small studies that improve patient care. I specifically recall the work done by Eva, where she works. It was intriguing and it helped reduce falls. And Tara's group made a point to reduce wait times for endoscopy patients by looking at trends. Have you considered approaching nursing management with an offer to help identify and begin changing practices that impact care? Nurse managers have more projects to complete than they have time in their workday. Your offer to help could not only lead to improved patient care, but add to your perceived value in the nursing staff. As you progress through this course, you will develop the skills required to help you not only with your individual practice, but also to help you in your role as nursing leaders. Remember, leadership is not a title. Leadership is an action word that can be implemented by any nurse in any setting. Often the most effective leaders are not the ones with a title, but the ones who make the call to action and drive the change based on evidence.